My lowest point, I think, was after getting over it, I guess, to find out that I did have breast cancer. Thinking about reconstructive surgery and all of that, and after I found out I didn't have to have that, I guess just going through the chemo, because it was rough because I couldn't drive. At times I couldn't function, and you just didn't know if you were gonna make it through the day.
When someone faces the diagnosis of cancer, they sort of are thrown into a storm that is disruptive to themselves, their families. It's a frightening place to be. I think that we here at Self have the tools, the personnel, the hearts, the healing hands that are necessary to provide a shelter from that storm.
I just thank God for them, for everything. I really do, for the folks here. I really do, because I had no direction in the beginning who I was gonna see, who I was gonna come in contact with, or anything. Because when they asked me, I was just so upset. I was like, it don't matter. Just whoever, it doesn't matter, because I don't know anybody anyway, so it's not gonna make a difference. But, I think God led me to the right folks from the beginning to the end.
So in essence, we're not treating patients. We are helping our neighbors, friends, and new friends.
So everybody knows what you do when you have cancer. You go to a cancer center. And I was blessed to live in Greenwood, 5 miles from my house. And so we hooked up. When they come in, they don't come in like you're fixing to die, even though you may be. They come in smiling. Hey, Mr. Sprouse. I said, call me Stanley, that's my name.
I think what is unique of Self Cancer Center in a sense is that it's small but comprehensive.
If there's any more people anywhere that care anymore in the medical field, I can't imagine who they'd be.
I did radiation with Dr. Funke here, and everybody over there in the radiation department was just as wonderful as well. They just kept you going, kept you uplifted, was there for you. But the folks here on this side, because it was so just detrimental to me in the beginning, I don't know how I made it through without them. I really don't. And even the support, not just the nurses and all, but just everybody, from checking in at the desk to on my way out, being greeted by the ladies out there, helping you to your car if you need it, just wishing you a good day. Just everybody was just uplifted. And that really makes a difference. And that's what we need as patients, cancer patients in particular, because a lot of those drugs can pull you down. You already got that low self-esteem about yourself because you're feeling so bad, and just to see a smiling face and somebody to uplift you really makes a difference.
Self Regional is the hospital with a vision. It's been here for many, many years, and it's been built by Mr. Self with the vision to provide a care close to home and a quality state of the art. And it truly is. So all the advances that are available out there, we get them at Self. Any medications approved by FDA, we will have them the next week available here. What makes a difference in people's lives is my colleagues and coworkers. I have excellent nurses, excellent support staff, and they all here to take care of our patients.
And he told me, well, we found something, and I'm going to want you to make an appointment. We're going to do biopsies and all the tests and everything. And I felt, wow, this can't be. It could be everybody else, but it can't be me. I take care of other people. I don't get sick. Things don't happen to me. But it actually did.
All of the people who are here at this cancer center really care about our patients, and not only care about them, their medical treatment, but also about them as a person and what are their hopes and their fears and help them, support them actually get through these treatments so they can beat the cancer and go on to live a productive and happy life.
I started painting. I forget how I started doing it. Somebody was telling me, do something that makes you happy, you know. Dr. Wood, every time I come in, he said, well, what are you doing today, Miss Laymon? What have you been doing since I last saw you, which was just yesterday? And I tell him the different stuff I did at work and at home. Started making me feel at ease. And I showed him a picture of one of the first paintings I did. He said, oh, this is wonderful. I said, no, it's not. I was thinking to myself, he's just being nice. He said, you got any more pictures? And I showed him more pictures. He said, oh, this is great. He said, you should keep doing that. You should keep painting. You're doing good. And they really encouraged me to keep on with the painting.
Deciding which treatment can be best for a patient is now a very individual type decision. Each cancer is very different and requires an individualized approach. Here at the Cancer Center, we have tumor boards, and we have collaboration between a variety of different physicians to make sure that each patient's individual cancer gets the attention that it needs.
We meet every week and discuss our new consults, patients. We go over their diagnosis, we review their pathology, we review their CAT scans with radiologists, and then we have a discussion with other doctors to find the best possible treatment. And our goal always is to cure. And if the cure is not possible, to treat it as a chronic disease.
All the doctors working on a particular cancer case are seeing the same things, discussing the same issues, and we feel that that provides a more comprehensive approach to the patient.
The other best part of Self Hospital is that we are affiliated with Medical University of South Carolina, and we do send our patients for clinical trials if needed. Some patients with advanced cancer, they might not have any further options after being on like many standard drugs or standard chemotherapy options, and they might like still progress. Like for those patients, like we tend to send them for clinical trials to MUSC.
We have the latest technology to really pinpoint the radiation to a very small area to deliver radiation dose only where we want it to go, and to spare the rest of the surrounding area. We offer surgical brachytherapy for prostate cancer and for gynecologic cancer. We offer the latest in stereotactic body radiation for lung, liver, spine, prostate. We offer stereotactic radiosurgery for brain tumors. These are treatments which are usually only found at major academic centers. And here in Greenwood at the Cancer Center, we have all these treatments available for our patients.
Small, family-friendly environment, yet patient can get world-class treatment.
A relative come and tell me she's been diagnosed with breast cancer, and I'm trying to guide her just like folks did me, and she's been calling me every day. I said, call me. I said, you're gonna cry? That's fine. I cry, I still cry. But I'm gonna help you get through, because people were there to help me get through. So, and like I told you, you'll be coming here. I told the folks are great, they're wonderful, they're gonna help you. They're gonna make sure you're fine, they're gonna keep you uplifted. You're not gonna be down, they're gonna be very positive with you. I said, and that's what we need, that's what got me through.
As a referring physician, I think you should expect to have good communication lines between the oncologic physician and should be receiving the medical documentation on a routine basis, not only at the beginning but throughout the treatment course, and a summary of the treatment once it's been completed.
I can give you an example is that a few days ago I just got a text from a physician in Newberry, and they asked, do we actually treating this kind of disease? When should they make a referral? So I was able to text them back. rather than use their office to call our office, and then the nurse calling us and ask a question, and reduce the looping around. Direct communication with the physician, that is always a plus.
To the referring physicians, I would say that we understand the position you're in. You have a challenging position. My father is a primary care physician, and he always told me about the struggles and the difficulties of handling all the breadth of problems that you have to handle on a daily basis. And here at the Cancer Center, we have physicians who are specifically ready to tackle all the problems and challenges that can occur with a patient with a diagnosis of cancer. And we hope that you would trust us with your patient to care for them and to also keep you informed to make sure that you're in the loop of what's going on with that patient, because it's not just fighting the cancer. We also require and really need the help of the primary care physician to get the patient through from a variety of aspects. So the primary care physician can be a very important part in helping patients navigate through this journey and this battle against their cancer.